On behalf of myself and Joanne Rogers, our chair of our board, I'm delighted to speak to all of you today on this just outstanding accomplishment for this community. I was reflecting last evening about where I was 25 years ago. In Vanna, I was not here, but I was somewhere that had a little bit to do with Credit Valley Hospital, and it was only as I was reflecting a few days ago with some folks on my staff about where I was that I remembered a particular moment, and that was about 25 years ago in November. I was a co-op student at the University of Waterloo, and my I think, second placement was with the Ontario legislature, not with any political party, but with what was called the Speaker's Office. But we used to roam around the same floors as both the official opposition and the government parties. And I often used to run into two individuals in particular. A man by the name of Bob Callahan, who I was not only an MPP, but I believe went on to be a mayor of Brampton at a point in time as well. And a gentleman by the name of Steve Offer, who was from Mississauga. And Bob Callahan and Steve would often meet in the hallway and be arguing it out, even after the decision had been taken, I believe, by Larry Grossman, about why this place, Mississauga, was getting this brand new hospital and Brampton wasn't getting their second hospital. And as I was reflecting on that the other day, I also recall them talking occasionally about this feisty newcomer to municipal politics. I think she was in her 6th or 7th year at that point, Mayor McCallion. And who knew, 25 years ago today, you and I would be the only two still here. Clearly, our founders had a vision, and were able to put a compelling story together, paint a compelling picture with very rich colors. Building a hospital back then was not an easy task. Getting those kinds of approvals, and I think about our sister hospital, Brampton, who just built their hospital a few years ago. That was a 30-year journey. So when you think about what was accomplished by those founders at kitchen tables, at dances, I'm sure at bake sales and everything in between, it's an enormous accomplishment to think that we're standing here 25 years later, with our success just at its beginning in many ways. And if that hasn't taught us anything about the importance of having a vision, I don't know what does. But when you add in the clear persistence of our founders and those who have come after, the relentless nature of their storytelling to both get the approval to move forward, but also to build the community as we did that. I think, again, it speaks volumes to the rich history that we've inherited. They also established an unwavering commitment to quality, innovation, to important partners when delivering healthcare. And the responsibility they took on our behalf, an enormous responsibility. They did not do this as part of their day job. This was done in evenings and weekends and really mining whatever time they could to move forward on our behalf. An enormous amount of responsibility they took on for us. And I want to just pause there for a second. I mean, those are not just words. I want our nurses and our doctors and our staff and the administrators and our volunteers and our board members to think about that responsibility which they've entrusted us with now. It is something that each and every day we can't lose sight of because we carry that torch on their behalf now. And that responsibility to create better health care is a promise. It's a promise that our past was founded on and that our future depends on. And as we deliver on that, we must draw upon the lessons of the past. I talked about the importance of vision. Together, we create better healthcare. The importance of partnership, working together. The perseverance that I spoke about. Perseverance is about about belief. It's about principles. It's about values. And we have that inherent in what we do. And the commitment our founders have to measuring our progress, not being simply satisfied with the initial build, but knowing it was nothing more than the first pillar of many to come as we built the community that we needed, the community that we had in Mississauga and the hospital that we needed. I remember within my first weeks, Dr. Giesler and he escorted me to my first medical advisory committee meeting. And I remember Dr. Latovsky coming into that meeting, and he was shaking his head a little bit, and he had clearly come from a long day in the emergency department. And our physician leaders coming around the medical advisory committee table, and he sat down and he announced that the province had developed some new guidelines and standards for emergency department wait times over and above what had been done the year before. And he looked clearly exasperated. How were we going to meet these kinds of deadlines, these kinds of wait times, these kinds of measures in an emergency department that was built for 50,000 and at that time was dealing with about 81,000? This emergency department had already been setting the tone for how care should be delivered. It had developed its RAS methodology, and that had spread throughout the province. It was meeting wait time after wait time, but now we were being asked to do more, frankly, with less. And I remember watching in my first medical advisory committee the engaged conversation that started with almost denial that this could possibly be the edict coming down from the province. I did neglect to tell them that I'd been part of the decision-making in my previous job that led to this. But I watched carefully as they talked about it, as they went through that denial, the dismay of it all. And then I remember, and I believe it was Dr. Bayless who looked up at one point, and she said, well, we just simply have to do it. And I remember at that moment, there was no argument. Everybody looked up and said, absolutely. And from that moment on in the meeting, we developed a whole series of strategies. And I can tell you, each and every day as the CEO and president of this hospital, I see that kind of can-do attitude emerging, flourishing, prospering. And I think that is, truthfully, part of our founding group and the legacy that they have left us, a can-do attitude that just doesn't know how to quit. So I don't believe our promise has been any more brighter than it is today. I know we have an unwavering faith in each other and in what we do. And I know that we can be even stronger and better as we move forward with that. Some of you have heard me quote before the African proverb which says, if you wish to go fast, go alone. But if you wish to go far, go together. So, together we will build, create, and lead better healthcare in Mississauga, in Ontario, and in Canada. I want to congratulate all of us on this accomplishment. I want to sincerely thank many of those who are here today who were there 29 and 25 years ago, and to say to you, on behalf of those who are still here working each and every day, on behalf of our community, we take up this responsibility extremely seriously. We are passionate about it, and we are enthusiastic about the future. Thank you.